Breast health, always an important topic and timely with October designated as Breast Cancer Awareness Month. Many women became proactive about their own health when Angelina Jolie revealed she had a double mastectomy and reconstructive surgery as a preventive measure after testing positive for the breast cancer gene. What can you do to minimize your risk? Experts from MidState Medical are here to give you the facts. Joining me now are Drs. Deborah Pan and Dr. Rajani Nadkarni, along with three sisters who decided to have the preventive breast surgery. We have Allison Burillaro, Cindy Kafka, and Sue Kamari. It's great to have all of you here with us.
Thank you for having us.
First of all, sisters back up there, how are all of you doing?
Fine. Great.
You're doing well?
Yeah.
Very good. So who is at risk for breast cancer?
So, breast cancer is a very common cancer in women, and in fact, about 230,000 cases were diagnosed just in 2012. So as you can see, 1 in 12 women are at risk for breast cancer. And in fact, the most common risk for breast cancer is age. The older you are, the more likely you have a risk for having breast cancer. However, having a family history increases your risk. But then what we really want to focus on is those risks where you carry a bad gene for breast cancer. And about 5 to 10% of all breast cancers are genetically driven. And the two genes that are now well known, well cataloged and tested are the BRCA1 and the BRCA2 gene. But 5% of breast cancers to 8% of breast cancers are genetically driven, and these are the two most common genes that we will see. As you can see with our three sisters who have the BRCA2 gene. Women with the BRCA2 gene who are carriers of the gene and haven't had cancer yet are about 45% likely to have breast cancer by the age of 70. BRCA1 gene, however, is much more powerful, and in that instance, about 55 to 70% of women who are carriers are likely to have that breast cancer. And in fact, that breast cancer is a very aggressive breast cancer called triple negative breast cancer, and most often presents before the age of 50. So it's extraordinarily important for women to look into their family history to figure out what their risks are and seek help if they believe that they have a mother, grandmother, father, aunt with breast or ovarian cancer, particularly if those cancers presented at a very young age. Certain ethnicities are at risk. Ashkenazi Jewish women are at extraordinarily high risk for having these genes, as well as Icelandic women, women from Norway or Sweden, as well as Eastern European women.
Well, let's hear from the women. What is your family history?
We had, our grandmother had breast cancer when we were all very young, and then we have two aunts who had breast cancer. And then it's not just breast cancer. My mother always also died of ovarian, which is connected, and we happen to be of Ashkenazi descent. So,
who decided first that they wanted to do this? I'm sure it was a discussion, right?
Allison. Well, after my mother had passed away, I had gotten, I wanted my genetic testing done, and it came back positive, and I had a hysterectomy and then let it go. I have 4 kids. One of them was still little, and then my sisters decided it's time, we're going to get our genetic testing done. And there's 5 sisters altogether, and 4 of us ended up being positive.
When you go for gene testing, I always, when I talk to people, I always say to them, you need to know what you're going to do with that information. Is that, when you went into it, did you have an idea as to what you wanted to do?
we knew options, our options. Our doctors had presented them to us, and Cindy and I had gone to a seminar. So we knew our options if it came back positive. We kept hoping, the other one was going to be negative, because we went together for the results. But so I think we knew pretty much right away that
if you have the information beforehand, it's very, very knowledgeable. It's a good thing to know your options and so forth when you go.
Well, let's talk about those options, Dr. Pan.
Well, basically, for the large majority of women, unfortunately, in the United States, only 20 to 30% of women are even offered the choice of reconstruction. So we are trying to work to increase awareness that women do have choices after mastectomy. But one of the most popular ways that we do reconstruction for women is implant-based surgery. And we do have some exciting new advances in that field. But for the most part, reconstructive surgery is so important, not only to allow women to physically put behind their cancer battle, but to emotionally put an end to the chapter of their fight, and to be able to get dressed in the morning, go out to social events, and really not have to think or be reminded of it constantly.
And it's really important to make sure that you go to a very good reconstructive surgeon.
That would be helpful. There are people who do specialize in this, people who do kind of promote this as part of their
I've heard
ongoing
many
practice.
stories from women who say
Sure.
that they've gone to a surgeon and they didn't do a very good job.
Right, right. And obviously, different patients bring to the table different tissue qualities and things like that that we have to work with. But you really want to make sure that the surgeon that you find has an interest, first of all, in breast reconstruction, and then also has the experience as well as the qualifications to do so.
What was recovery like, ladies? Go ahead.
Well, we were well prepared when we went in.
We had great support systems.
Oh, yeah.
Our boyfriends,
We had-
husbands,
yeah.
families were, and Allison went one first, I went a month later, and Sue went a month later. So we were all recovering at the same time.
And we
We were there for each
cared
other.
for each other. We went to all our appointments together with each other. And
Recovery was, it went well, I think, for all of us. I feel for myself that the recovery was that much easier because we were that well informed of what to expect, what happened. And of course, when you go to your doctor's appointment, you know, everyone was so kind and compassionate. I thought it went very well.
it's nothing like it used to be years ago. I mean,
Absolutely not, and we have examples here. Let's talk about what's in front of us here,
Yep.
Dr. Pan.
So as far as implant reconstruction is concerned, our current implants are excellent. There's really no problem that we have with them. But there is a new option available that's been recently FDA approved. These implants are newer. They're called form-stable shaped implants. They've been available in Europe for several years now, and our FDA just basically kind of caught up and decided that the data were good enough to release to the United States. So what we have here, most of our breast cancer patients do end up choosing either saline or silicone implants, but in the silicone variety, which tends to feel more natural, this is generally a good example of what we typically have. And the silicone implants, as you can see, have a softness to them, but one of the downsides to the softness is that when you're walking around, if your tissues are thin, it can collapse a little bit.
Right.
So in order to combat that problem, manufacturers have now come up with a more form-stable implant. And you can see here there's more of an anatomic teardrop shape. And you can see that the gel stands up and has a little bit less of that rippling quality to it. So there's a little bit more forgiveness in the rippling and profile of the implant. The trade-off is it is a little bit firmer, not by much, but for the appropriate candidate, this may be an option nowadays.
Okay, we don't have much time left, but we do want to talk about the symposium.
Yes.
So the Breast Symposium at MidState Medical Center is our annual Breast Cancer Awareness Month event that we run through our hospital. And we have different speakers that talk about different things. And one such symposium was where our sisters here heard about the risks of the gene, as well as who to go to, what kind of counseling should you have before. So our breast symposium this year will be about recent advances in breast cancer, and it will be on October 22nd.
That's right, and there's so much information
Yes.
that women need to know, women and men,
Yes.
because men also can get breast cancer. For more information on the MidState Medical Center or the annual Breast Symposium, you can call this number 203-694-8631 or visit midstatemedical.org. Thank you all for being here.
Thank you for
I know
having
you've
us.
helped a
Thank you for
lot
having
of people by just sharing all this information.
Thank
you very
you.
much.
You're welcome. And coming up next, join me in the kitchen with Stephen Fries for a scrumptious breakfast dish, blueberry baked French toast. But first, take a look at this.
It's time for the Connecticut-style medical tip of the day from MidState Medical Center. Women, have a mammogram once a year after age 40. Catching a tumor early boosts the chances of survival significantly. The 5-year survival rate can be as high as 98% for the earliest stage localized disease, but hovers around 27% once it is spread. This medical tip is brought to you by MidState Medical Center. Visit midstatemedical.org.